Your CNOS Health Watch on Siouxland News.
When it comes to shoulder arthritis, treatment can be tricky, but now new technology is allowing doctors to give relief to patients who usually assumed nothing could be done for their pain. Siouxland News reporter Katie Link has more.
These hard-working farmers that come in that have been putting up with this pain for years, and they just can't move their arm at all, and then they come back in and they feel like they have a new lease on life with their arm.
We all have cartilage throughout our body. In joints, it ensures almost frictionless movement.
At the expense of healing capacity, there's no blood vessels in cartilage, and so once it's gone, it's gone. And the process of losing cartilage in any of our joints, including the shoulder, is called arthritis.
Orthopedic surgeon Dr. Brian Johnson specializes in advanced shoulder and knee reconstruction at CNOS, where they see over 2,000 shoulder injuries a year.
People with shoulder arthritis often have had prior injuries before to their shoulder, or they've had rotator cuff disease, prior fractures, or rotator cuff injuries in the past.
Patients with arthritic shoulders suffer from pain and restricted movement. Sometimes surgery is the best option.
Arthritic shoulder with an intact rotator cuff, you can replace the shoulder in a normal way. You replace the patient's anatomy, you replace the ball for the ball, and you put a cup where the cup used to be.
But in a shoulder where the rotator cuff is no longer intact or repairable, a relatively new technique called the reverse total shoulder is a great alternative.
I've had many patients that come in that they haven't been able to move their arm for years, and they've been told there's nothing they could do for them, and then they'll come into my clinic next time and have their arm up like that.
The procedure places a ball where the cup used to be and a cup where the ball used to be. The result? The patient can move without pain and without a rotator cuff.
Start to move up and down because the rotator cuff muscles are no longer keeping the shoulder in the joint. So in that situation, you need something to keep the shoulder from becoming vertically unstable. The geometry of a reverse total shoulder is such that you do not need one for the shoulder to function.
For Siouxland News, I'm Katie Link.